All right, we're going to go ahead and get started. It's 2 p.m. I'm Dr. Leslie Cottrell, and it's a pleasure to introduce our November, can't believe it's November, speaker for the Ability Grand Rounds. This is a series of presentations that are national, international peers doing great work in areas that pertain to our center and our center mission. Each month we have a presentation and they've been great. They've been recorded and are on our website. I can put some links in there for previous topics. But it's just been an honor to do these. And the idea is the world is pretty small, particularly with Zoom. And so we get a chance to look at evidence-based research, trainings, again, from our peers. Just a little bit of housekeeping. Closed captioning is available. Please let me know if you have any issues or questions with finding that option. We've all been on Zoom for years now at this point, but remember to mute your line. With that being said, we would love to have any questions you have. Feel free to put that in the chat, or there will definitely be time at the end designated for questions. While I'm speaking about the chat, if you could provide your name and affiliation, that gives us an idea of who's with us today. And of course, I see some of you with your cameras on. Thank you, thank you, thank you. It's always nice to see people, faces. That's wonderful. And I think with that, let me introduce our speaker. So Dr. Sally Lindsay joins us. She's from Toronto today. She's a senior scientist from Bloorview Research Institute in Holland, Bloorview Kids Rehabilitation Hospital. She's a professor and affiliate scientist, in the Department of Occupational Science and Occupational Therapy and Rehabilitation Sciences Institute. And that's again at the University of Toronto. You see her slides, and with that, I will turn it over to Dr. DeLindsay. Thank you and welcome.
Great, thank you. So it's great to be here. Good afternoon, everybody. Yeah, so I'm Sally, and I'm a scientist based at a children's hospital in Toronto, and most of my work focuses on the participation and inclusion of children, youth, adults, young adults, and their families, and how we can help to support their well-being and inclusion in society. And this is a little bit of a newer area for me on climate-related emergencies and disaster preparedness, but I did this scoping review a year or so ago because it just seemed to be a more timely topic with a lot of the extreme weathers that we've been having in Canada and that we've been noticing across the world as well. Whoops, slides. Here we go. So just a little bit of background on the topic. We know that emergency and disasters, both either natural or human caused, such as floods, wildfires, pandemics, they're really been increasing in intensity and frequency. We are often seeing in the news, a lot of these things are happening. And we also know that people with disabilities are at a much higher risk of experiencing the negative impacts of disasters. And they're often not considered in policies or services or any interventions or resources that are related to preparing for or responding to emergencies. So here's just a little overview of some of the trends that we've seen. So according to the United Nations, climate-related disasters have increased fivefold over the past 50 years. And for example, in the US, the number of billion-dollar climate disasters rose from an average of 3.3 per year in the 1980s to 23 per year between 2020 and 2025. So a huge increase that we've seen. And in looking at some of the types, or at least some of the more common types of emergencies that have been increasing most rapidly. So heat waves, we're seeing record-breaking temperatures that have become more frequent and intense globally. Wildfires, we're seeing quite a lot of those in Canada every summer. They're also growing in frequency, size, and the destructiveness, mostly due to warmer temperatures and prolonged droughts. Floods, so flash flooding, river floods are also becoming more common due to the extreme precipitation events, and also cyclones and storms and droughts becoming more prolonged and severe, which are affecting water availability and agriculture. So we know that people with disabilities are considered a vulnerable group, but they're often not considered specifically within a lot of policies. So for example, the United Nations Convention on Rights of People with Disabilities highlights that they should not be compromised in situations of risk, including disasters and natural hazards and extreme weather emergencies. And considering people with disabilities is very important because they make up around 16% of the global population. So around 1.3 billion people have a disability. So why are people with disabilities considered to be more vulnerable? So there's many different factors that can explain this. So first, they often have a more limited mobility and evacuation challenges. So, for example, many people with disabilities may rely on a mobility aid. So, if they're using a wheelchair or some other kind of assistive device, it can make evacuation during emergencies a lot more difficult. And in disasters like wildfires, floods, evacuation routes and shelters are often not accessible. Like it's one of those things that's kind of an afterthought that people haven't even really considered. There's also higher mortality rates. So people with disabilities are 2 to 4 times more likely to die during a climate-related disaster, such as a hurricane, heat wave, and flood. And also disruptions of medical care. So, for example, climate events often interrupt access to essential medical services, medications, and assistive technologies such as ventilators. There's also communication barriers are a common concern during emergencies. So, for example, emergency alerts and evacuation instructions may not be accessible to people with hearing, vision, or cognitive conditions. And also economic and social disadvantages. So people with disabilities are more likely to live in poverty and have limited access to resources, which can make responding to or recovering from an emergency more difficult. And also post-disaster displacement. So people with disabilities are more likely to be displaced and less likely to return to their homes after a disaster. And again, also underrepresentation in planning. So climate and disaster planning often overlooks the needs of people with disabilities. So what is the vulnerable effect on people with disabilities? We know that they often experience disproportional effect of disruptions in power, running water, and access to health services. They have higher rates of injury and death, so they are 3 times more likely to not receive medical assistance during and immediately after a disaster. And we know that government and community organizations are often unprepared for emergency situations and have a lack of resources and recovery response to specifically meet the needs of people with disabilities. So again, um, just to mention that people with disabilities are often overlooked in policy and planning. And we know that although there are several major international mandates, frameworks for disaster risk reduction, and also the UN Convention on Rights of People with Disabilities are there to help support emergency preparedness and risk reduction for vulnerable groups. But policies, services, and interventions related to disaster adaptation and planning and emergency preparedness are often overlooking and not really considering the specific needs of people with disabilities. And this leaves them at a much higher risk of experiencing the negative impacts of disasters. And there's still many significant barriers that prevent people with disabilities from preparing for disasters. So accessing early warnings and also participating in preparedness plans. So why focus on children and youth? Most emergency preparedness plans and policies for vulnerable groups in general, including people with disabilities, they often prioritize adults or elderly. So when people with disabilities are included in these plans, they're assuming that they're an older person. There's often never really a consideration that a person with a disability could be a young child. And this is important because kids with disabilities make up around 15% of all the world's children and face one of the highest exposures and vulnerabilities to disasters and extreme events. And although emergency preparedness can help mitigate some of these disaster impacts, many households with a child with a disability face significant challenges in preparing for and responding to disasters and emergencies. So some other reasons why it's important to focus on children, because they also are more likely to live in high poverty areas and are among the most vulnerable to the devastating impacts of disasters. So they often would more likely to live in like an area of high risk of flooding, for example. They have higher levels of disaster exposure, lower levels of disaster preparedness, and less recovery supports. And they're also at risk of negative health outcomes due to pre-existing medical conditions, so mobility challenges, language impairments, and they're also in danger of facing life-threatening consequences after a disaster, especially if they're separated from their parents or their caregiver. So emergency preparedness policies for children with disabilities, they often, as I mentioned, they often really lack specific attention to children. And children and youth are underrepresented in disaster training for medical assistance teams, even though pediatric patients make up the majority sometimes of disaster victims. Children with disabilities are vulnerable to emergencies and disasters, and we know that they face higher levels of disaster exposure and risk of negative outcomes, um, lower disaster preparedness, and less recovery support. We know that they experience challenges with taking protective or preventive measures, escaping and recovering from a disaster, which often stem from a lack of individual and community-based resources. And also a lack of first responders' knowledge about people with disabilities and sometimes discriminatory practices. We know that children are less likely to leave a threatened area, sometimes because of environmental barriers, lack of accessible transportation, lack of emergency shelters, or also because of legal issues of who can be responsible for them if they are separated from their parent. So our team conducted a review and we noted that this was important because there were several key gaps in the literature. So not most of the research so far has not focused on specifically on children and youth with disabilities or chronic conditions in terms of emergency preparedness. What has been done has, like, school-based emergency plans often don't focus on the needs of children with disabilities. Some work has looked at the role of clinicians in emergency preparedness, but not necessarily considered how children are considered in that. And others have looked at various types of vulnerable groups, but sometimes people with disabilities may have been included in that, not necessarily children. And some research has focused on specific types of disasters or a specific location. So our objective of our review was to understand the experiences of emergency preparedness among children and youth with disabilities and chronic conditions, their families, and caregivers. So our review took a systematic search of 6 databases. We had 2 reviewers independently screen using the Covenants software, and we analyzed the data and the findings using a narrative synthesis approach. Our key terms involved in the search, including sets of terms around emergency preparedness, disability and chronic conditions, children and youth. We included only empirical research published in peer-reviewed journals that involved a sample of children and youth up to the age of 25 that had a disability. And they needed to have at least one empirical finding on experiences or impact of emergency preparedness among children or their caregivers. So after screening through all of those titles and abstracts, we found that 27 articles met our inclusion criteria. And these involved, spanned across 9 countries over a 20-year period, involving over 2,600 participants. It included quite a wide range of various types of disabilities and included perspectives from parents, children, educators, clinicians, and other relevant service providers. So an overview of our findings, we found most of them focused on extent of emergency preparedness, factors affecting preparedness, and also some interventions that can help. So first, I'm looking at some of the studies around the extent of emergency preparedness. So only 2 studies focused on children's perspectives of emergency preparedness within the school setting. So for example, children with various types of disabilities in New Zealand demonstrated a high level of awareness and understanding of natural hazards. Children identified available resources within the school that would be necessary during a hazard and were able to also point out what some of the dangerous spaces were. In another study, researchers found considerable variation in how children could access resources and cope with hazards. And children were able to consistently link the hazards to the potential effects and protective actions, which helped their preparedness. We found 9 studies that explored families' perspectives on emergency preparedness, and this showed really quite a wide range and mixed findings. So, for example, many families reported that they were unprepared for disaster-related events and had lower levels of basic preparedness compared to the general population. So for example, 69% of children with special healthcare needs lacked an emergency supply kit, and 93% reported that they didn't have an emergency information form completed. Other studies reported that most families of technology-dependent children were unprepared for emergencies and had even though they had significant disaster preparedness needs. So for example, less than half of families in a US survey reported taking a child to a hospital because their power was out, or they would do that in a situation where they had a prolonged power failure in the future because they didn't have the appropriate plan in place to keep their power on. Another study showed that 85% of families had no emergency plan at all, and 40% had no emergency kit, and 65% didn't have a copy of their medical emergency plan. And findings for families on preparedness were mixed. Some families felt that somewhat prepared for disaster emergency. So, for example, 55% of patients were prepared and had emergency oxygen backup or power generators so that they could stay at home in a disaster. And some parents of children with developmental disabilities said that they had less than a moderate amount of preparedness. And most of them took fewer than half of the recommended actions that were expressed in their plan. And in another study, families of children with diabetes in the US felt that they were better prepared for self-management of their condition compared to others. So over 75% of families said that they had enough supplies to maintain their care for at least 3 days, although 62% of families were unprepared for a major disaster. So really quite mixed findings amongst the families, depending on the type of condition. And in terms of school, educator, and community perspectives, 10 of the studies focused on these aspects. So, for example, a New Zealand study on children with disabilities identified challenges in school disaster preparedness plans, including limited emergency supplies and equipment, ineffective communication, and the absence of procedures and accessibility plans. So, one study assessed emergency management policies and plans and found that most schools had a disaster management plan, but less than a third actually addressed the needs of children with disabilities. And even more concerning is that most schools weren't even represented at a lot of these local disaster management groups. So only one study emphasized the need to clarify the school's kind of more legislative requirements and the importance of establishing benchmarks for standard operating procedures for emergency activities. So for example, one study described the experiences of school stakeholders in New Zealand and how they had this neat 6-stage model for effective school-based emergency response. And the model included alerts, safety behaviors, response actions, student release, family reunification, temporary schools closure, and then business as usual. And they emphasized that the importance of including students in drills to help prepare them for real life emergencies so that we can ensure that they were prepared for like evacuation routes and what to do. So our second main theme that we found from the studies in our review was factors influencing emergency preparedness for children with disabilities. And so this included things like type of disability, disaster type, the location, resources, so the knowledge about disabilities, and also engagement and resilience. So in looking at the type of disability, that this had quite mixed findings as well. So 5 studies found that type of disability influenced emergency preparedness, such as managing the disability and related medical needs. So, for example, coping with the disability created barriers to disaster preparedness among some parents of children with special needs in the US. And some families who had children with multiple medical needs were found no better prepared than families who didn't have any needs. And in other studies, some researchers found no differences between in the preparedness levels of families of children with disabilities who use medication and those who don't. And one study found children with diabetes were well prepared for hurricanes. And some school emergency plans, they really varied by type of disability. So sometimes they were more often focused on physical accessibility and not how to deal with other kinds of disabilities like sensory impairments. And another factor, so 5 studies looked at disability type and how this influenced preparedness. So, for example, 51% of schools in an Australian study reported being prepared for a bush or wildfire, but only about 10% of disaster plans address the needs of children with disabilities for other hazards, such as flash flooding. And some studies describe the level of preparedness was not at all linked to the level of a disaster. Um, and 2 studies found that the location affected preparedness and reported that rural families had lower levels of being prepared. So another factor affecting responses was resources and supports. So 6 studies explain how resources influence preparedness. So studies across US, New Zealand, Australia, and China consistently reported that a lack of resources, supplies, and equipment for emergency preparedness. For example, in an Australian study, about 1/4 of schools surveyed reported that they needed more resources and advice and education and training on disaster planning. And others also said that barriers such as difficulty accessing resources, limited supplies, and policy restrictions really affected their, ability to be able to prepare for emergencies. And 7 studies reported that knowledge about emergencies and disasters really influenced their level of preparedness. So having hazard education and training within schools can help preparedness. For example, among schools surveyed in New Zealand, they implemented a hazard education program and emergency response training. Some studies also reported that lack of awareness was due to, in part, a lack of accessibility barriers. And some schools and educators reported that they just lacked knowledge and training. And there was one thing that we saw across most of the studies that they really weren't involving people with disabilities or their families in some of the plans that were supposed to be about them and for them. One other factor is resilience and coping. So, for example, a study found community involvement and engagement were key coping strategies during disasters, and that having higher levels of support, such as like social support, self-efficacy, family resources, were associated with being better prepared. And other studies found that families with a higher socioeconomic status were better equipped during an emergency. And another study also found that building meaningful relationships among neighbors and the community really helped that community response that could help with coping mechanisms as well. In our third theme, we found a few interesting interventions, kind of like toolkits that people had described and their impact on emergency preparedness. So in one study, they used a disaster supply starter kit, something similar to what I have on the picture here. It was like a backpack with resources on disaster preparedness, basic things like flashlight, um, like batteries, first aid kit, and supplies. And they found that post-intervention, that the kit showed significantly more participants reported having a home fire escape plan and communicating with their power company if they needed to quickly get the electricity back on in their home. If their child, for example, was dependent on like a on that kind of device. And in another educational intervention for disaster preparedness, both of these were, by the way, were delivered through children's hospitals. And this one included, similarly, the family emergency plan, information form, resources, flashlight, first aid kit, those kinds of things. And they also found a significant higher level of preparedness 1 month after the intervention. And a couple other interventions. So one was similarly an education disaster survival toolkit, it was called. And this was for families uh, where their child was nutrition dependent child. So they had a feeding tube. And this intervention found significant improvements on developing an emergency plan, having an emergency supply kit, and increased confidence and readiness for a disaster. And one other one was also delivered through a hospital, an inpatient educational preparedness kit, and they found significant improvements in the level of disaster preparedness. So to sum up, we found that most families and schools seem to be largely unprepared for disasters and emergencies. There seems to be quite a lack of support for people with disabilities to prepare, to evacuate, and to recover from disasters. And it seems like we really need more education, training, and resources, both for the people with disabilities, their caregivers, for schools, and for people who are helping to prepare and respond to emergencies. When most importantly is we really need to involve people with disabilities and their families in these plans because they know best what they need, um, how they navigate the world, accessibility issues, medical issues, and more of the specific details of what goes into that. But the good news is that there is some evidence on some interventions that are showing effectiveness in how we can take some steps towards better planning for emergencies. So what are some of the implications? So support is really needed for emergency preparedness, especially for children with disabilities at both the individual, the family, and community levels. And clinicians and service providers should really consider assisting in developing these emergency plans. And clinicians and educators and others should also continue advocating for including people with disabilities and their families in these plans. So where are the next steps also for research? It would be interesting to think about whether generic kits like emergency preparedness in general is more effective than maybe a disability specific kit, especially if they're designed for children. It would be interesting as well to consider exploring what are the specific types of disaster preparedness, especially those related to extreme weather events and climate change related issues. And we also need more research on how we can involve people with disabilities or vulnerable groups in such planning. And yeah, that was my slides. I do have, if you want to, feel free to reach out if you want a copy of the paper, or you can scan the QR code, which brings you directly to the website, and happy to take any questions.
Thank you so much. It's really interesting. And again, Dr. Lindsay and I spoke a little briefly before starting that we've been hit by several floods in particular, and so this is pertinent to us and our FEMA partners for sure. Anyone have any questions for Dr. Lindsay? Okay, I do. Dr. Lindsay, based on your review, what were the next steps planned on your end for um, either your team or the hospital in general, based on the information you gathered?
Yeah, well, yeah, it seems like this area, at least for kids and this particular group, like people, the research on people with disabilities is thankfully emerging. More people are paying attention to them as a vulnerable group. Um, Not specifically children and youth. So I think that might be the next step, is to then think about what might be a little bit different, like how might some of these plans and policies and things that we need to think about, how might that play out for children? Because, it does seem to be a little more complicated when you think, okay, kids spend their day at school, how does that play out? What's teachers' responsibility? What if they're separated from their teacher or their parents? Like, there's a whole lot of other layers to think about. And children may not know how to respond, if there's a lot of differences between adults and children. So I think next steps could be kind of doing somewhat of a needs assessment, I guess, of children and families, and also educators and clinicians, seeing what is their level of knowledge and understanding and where do they need supports, and then how could we maybe build and co-create a solution that might be meaningful for them, whether that's, a toolkit or whether that's policy or what that looks like.
Yeah, that's great. I don't know of any efforts here that have included kids. I don't know if anyone else has heard. Nita, I saw your hand up.
Yeah, I was going to ask another question if you're done with that topic. Yeah, so I'm sorry if I missed it. The kits that you were discussing, did you find any sort of like funding sources that are out there? Because I work with a lot of disability organizations that could actually make those kits, but it would just be funding the
The
materials
kits.
for them, right?
I would have to look at the specific studies, but I believe most of those ones were from the US.
Okay.
But yeah, I can find that out for you if you want. I don't know who funded the kits.
Yeah.
I think, I'm not sure if all of them, but I think I recall actually some of them might have partnered with Red Cross or something like that.
Okay.
But I
Interesting.
can
I
look at
primarily
that, yeah.
Yeah, I primarily work with state agencies, so I just know from that that West Virginia, as far as I'm aware, doesn't have that budgeted. So it would just be finding the source. But yeah, if you can send more info, I'd appreciate it.
Yeah, yeah, no, that was something was thinking could be an interesting next step too, is how do you get someone to fund such kits? You know, do a little pilot like from our hospital or something like that would be kind of fun. I don't think I've seen any Canadian studies. They were all, those interventions were from the US, and certainly Australia, New Zealand seem to be the leaders in this field of emergency preparedness. Yeah.
Gotcha.
Well, and Dr. Lindsay, I mean, if you want to, if you get additional information, we have everyone's registration, and so we can send information out. And then Nita, if you start down that path of trying to figure that out, let us know. It would be a really great collaboration.
Yeah, I mean, we use the term CRPs, but community rehab programs. So, I mean, day hab individuals, like those kitting projects are perfect for individuals who are less mobile. So, I mean, it would be wonderful if the workforce who's, making it was helping out the population who's affected by it. So yeah, that'll be cool. I'll let you know.
Cool.
Yeah, yeah, no, that would be very interesting. Yeah. And I'll see if I can look at those specific studies to see who funded them, but
Okay.
Perfect. Any other questions? This is great. All right. Well, Dr. Lindsay, I appreciate you joining us and sharing your work. A scoping review is a big task, and so it's needed to keep us going forward. Appreciate that. If you haven't already, I put a link for an evaluation. We always love your feedback. We want to make it stronger. We have another starting next month that we could implement. But other than that, everyone stay warm and have a great afternoon. Thank you for joining us. Thank you, Dr.
thanks
Lindsay.
everybody. Bye.
Bye.